how common is that in your practice?
So, thanks for asking this question, Dr. Pal. I think dry eyes, actually, if you look at it, is one of the most common symptoms, signs, and symptoms of a patient coming into the clinic. Why is it happening? What's happening here? There are a multitude of factors that involved in dry eyes. Although we just say there's three-letter word dry eye, but actually what it is environmental. So they're in AC all the time. There is always a fact where your screen time is increasing, so you're always viewing screen.
AC decreases the hydration.
AC reduces the hydration of the eyes because you're evaporating the aqueous layer from your tears. Tears are made up of three layers.
Ah.
There is an aqueous layer, which is in the middle. You have a mucus layer that is attached to the cornea, and then you have a lipid layer on the outside. So you have the mucus layer that helps take the aqueous layer and absorb it into the cornea. Because the cornea itself, if you look at it, is actually hydrophobic. It does not like water. It does not like aqueous. So it needs a mucus layer for it to absorb the aqueous into the eye. The lipid layer, on the other hand, which is the outermost layer, helps prevent any evaporation of this aqueous layer. So there is a very clear demarcation why these three layers are present in the tear film. Any disruption in any of these three layers can cause a big issue of dry eye syndrome.
What a fascinating anatomy, huh?
It's a fascinating one.
So the outer layer is fat.
Fat, lipid layer,
Inner layer is filled with liquid.
liquid.
That's where your tears and everything having a good hydration.
Correct.
So when
And
the
the mucus
outer
layer is in under the aqueous.
under the aqueous,
That is touching the cornea.
touching the cornea. Cornea is your covering of your eye,
The window, the black of the eye.
black of the eye. So this fat layer is protecting. So anything that is disrupting the fat, it's basically as an opening to reach the.
So what happens is that different glands secrete these three layers. The aqueous is secreted by the lacrimal gland. The meibomian gland, which is on the lid margin, secretes the lipid layer. So any disruption in the meibomian gland will have lipid layer loss. Any disruption in the lacrimal gland will have aqueous layer loss.
Lacrimal gland is a gland that secretes tears.
Correct.
Ah.
It secretes the tear. The so-called tear is only the aqueous.
Aqueous.
But there are two more layers which are extremely important in tear film or in dry eye syndrome.
Wow.
So all these multitude of factors, so there can be environmental factors, there can be a genetic factor that can cause this, there can be a gland related issue that can cause this, there can be social interaction, that means your social media as you call it, and that's been a big revolution. That's one of the main reasons why today you're seeing an increase in dry eye syndrome. You're also seeing increase in red eye syndrome. You're also seeing increase in myopia, and especially the younger adults and the children. So multitude of factors. You can even call it, stress. This sleep is disturbed. The cognitive functions next day are disturbed. Mental health issues. Multitude of factors coming just from screen time.
So
And
screen time can cause eye problems.
For sure, especially increased screen time that all our age groups. I mean, regardless of 5 to 95, all are facing the same issues.
What happens because of prolonged screen time?
So the minute you're doing anything prolonged screen and any kind of prolonged screen time, and let me just give you a small analogy to this, not analogy, a story to tell actually. We were all introduced in 1999 to the dot-com bubble. The internet, the so-called internet came about. Then you came 10, 12 years later into the so-called mobile phone generation. That became very proficient. But it still didn't increase the screen time until the social media came into play. Once you got social media in your hand, you have the power of independence, power of freedom, so much more to do. And that increased the screen time to a substantially high level. This happened, probably 2016, 17. 4 years later, COVID happened. Now everybody's sitting at home. And this broke out a complete new epidemic. An epidemic of screen time came about because of two main factors, social media and COVID. these two have just throughput the whole screen time to a whole new level. So multitude of these factors, increased screen time, can cause dry eye syndrome, I already said, red eye, increased myopia. You can have increased amount of sleep deprivation